Vitamin B6 plays a far more significant role in hormonal balance, particularly in women, than most health narratives acknowledge. While the mainstream conversation around women's hormones often revolves around birth control pills, hormone replacement therapy, or antidepressants, very little attention is paid to foundational nutritional support. And yet, B6 is a critical player in the regulation of estrogen, the metabolism of steroid hormones, and the modulation of symptoms associated with premenstrual syndrome, PMS. In truth, this humble vitamin could be one of the most underutilized tools in women's health. At the biochemical level, B6, primarily in its active form, pyridoxal 5-phosphate, PLP, is involved in the metabolism of steroid hormones such as estrogen and progesterone. It plays a key role in hepatic, liver, clearance of excess hormones, facilitating the breakdown and excretion of estrogen in particular. When B6 is deficient, estrogen metabolism can become sluggish, leading to a condition commonly referred to as estrogen dominance. This isn't necessarily an excess of estrogen in absolute terms, but rather a relative excess compared to progesterone, a hormonal imbalance that can trigger a cascade of symptoms: bloating, mood swings, irritability, headaches, fluid retention, breast tenderness, heavy periods, and even anxiety or depression. B6 steps in as a metabolic buffer. It enhances the function of enzymes involved in phase I and phase II liver detoxification, allowing for more efficient clearance of estrogen metabolites. It also supports methylation and sulfation pathways, essential processes for processing and neutralizing hormonal byproducts. Without this support, estrogen can recirculate in the bloodstream in more potent forms, exacerbating PMS and contributing to longer-term risks like fibroids, endometriosis, or even estrogen-sensitive cancers. Furthermore, B6 influences the production of neurotransmitters that are tightly linked to hormonal cycles. It helps synthesize serotonin and GABA, both of which have calming, mood-stabilizing effects. Many women experience sharp declines in these neurotransmitters during the luteal phase of their cycle, the week or two before menstruation, leading to increased irritability, sadness, or anxiety. These symptoms are often addressed with SSRIs, anti-anxiety medications, or hormonal birth control. But in many cases, the real issue may be inadequate B6, which disrupts both hormonal metabolism and neurotransmitter synthesis simultaneously. Addressing this root imbalance can reduce the intensity and frequency of PMS without the side effects of pharmaceutical interventions. In fact, B6 has been studied specifically for its effects on PMS. Clinical trials have shown that doses of 50 to 100 milligrams per day can significantly reduce common premenstrual symptoms, including mood changes, breast pain, fatigue, and bloating. The mechanisms are multifactorial: enhanced estrogen clearance, improved serotonin synthesis, reduced prolactin levels, and greater stability of blood sugar, another often overlooked driver of hormonal mood swings. Despite this, very few doctors suggest B6 to women presenting with these issues. It's a baffling omission, given the relative safety and cost-effectiveness of supplementation. One reason for this neglect is that modern gynecology, much like psychiatry, has become pharmaceutical-centric. The first-line treatments for hormonal issues are almost always pills, oral contraceptives, hormone replacement therapy, or antidepressants. These options can provide relief, but they often suppress symptoms without resolving the underlying metabolic inefficiencies. Worse, they can further deplete B6. Oral contraceptives, for instance, are known to lower B6 levels, which may exacerbate the very symptoms they're intended to manage over time. It creates a vicious cycle. Hormonal disruption leads to medication, which leads to further nutrient depletion, which leads to persistent or worsening symptoms, and often more medication. B6's benefits don't end with PMS. It also plays a role in regulating homocysteine, an inflammatory marker that rises in pregnancy complications and menopausal cardiovascular risk. It supports immune regulation, reduces inflammation, and stabilizes mood, all of which intersect with hormonal transitions across a woman's lifespan. From puberty to menopause, B6 is involved in virtually every phase of hormonal change, yet its presence in women's health protocols remains almost non-existent. Another contributing factor is the persistent gender bias in medical research and treatment strategies. Women's health has long been underfunded and under-researched, and when symptoms are reported, especially those related to mood or pain, they are more likely to be dismissed or psychologized. The idea that a nutrient like B6 could meaningfully alleviate cyclical depression or physical discomfort doesn't align with the dominant pharmaceutical model, which prefers more targeted, read, patentable solutions. But the clinical reality suggests otherwise. Many women intuitively reach for magnesium, B-complex vitamins, or herbal formulas for PMS relief, but without knowing the precise role that B6 plays. When given in appropriate forms, ideally as P5, P, or a well-absorbed B-complex, it can provide powerful symptom relief. And unlike hormonal drugs, it does so without suppressing natural endocrine rhythms or introducing exogenous hormones into the body. It works with the body, not against it. In summary, vitamin B6 is not a fringe player in women's health. It's a central metabolic regulator with the ability to alleviate estrogen dominance, reduce PMS symptoms, support mood balance, and enhance hormonal detoxification. Its absence in conventional treatment models is not due to a lack of efficacy, but a lack of awareness. The science is there. The clinical relevance is clear. But the conversation hasn't caught up. Until it does, countless women will continue to battle hormonal symptoms with prescriptions that suppress rather than support their biology, while a quiet, affordable, and biochemically elegant solution sits just outside the spotlight.